Exploring the opioid epidemic in Arizona, steps taken to curb overdoses.
It is going to take us a while before we can get there.
And prevent addictive narcotics from entering the state.
We literally cannot inspect 100% of the people traveling into the U.S.
Plus, understanding the lasting pain addiction creates.
We had to sit and watch our daughter die over a period of time.
Hello and welcome to Arizona 360. I'm Lorraine Rivera. Thank you for joining us. We begin the new year by visiting an ongoing issue facing our state, the opioid epidemic, a crisis that has claimed lives, funded cartels, and left families in turmoil. It's the first of our series, Arizona Addicted. Over the course of 12 weeks, Arizona Public Media will explore the solutions, stories, and science behind the ongoing opioid crisis in southern Arizona. Our coverage begins with a look back at how we got here.
The abuse of painkillers derived from drugs called opioids is an epidemic.
It's growing, and it's growing fast.
In 47 minutes, there was already 9 deaths.
But the opioid is something that nobody's seen anything like it.
As word spread about an epidemic taking hold of the country, by 2017, Arizona realized it too was in its grasp. A report from the Arizona Department of Health Services, or ADHS, found that in 2016, nearly 800 people died from opioid-related overdoses, on average about 2 people per day. Opioid prescriptions had also risen by 300% in the last 15 years. It led Governor Doug Ducey to declare an emergency in June of 2017, resulting in new prescribing guidelines, stepped-up data collection on suspected opioid overdoses, and more training for law enforcement on administering naloxone to reverse the effects of an overdose.
When there's an epidemic, when people are dying, then we have to act.
By January 2018, state lawmakers unanimously passed the Arizona Opioid Epidemic Act, establishing even more provisions in hopes of reducing opioid-related overdoses and deaths. From the onset, ADHS has been tasked with implementing many of those policies. I sat down with the department's director, Dr. Kara Christ, to discuss their impact.
We were able to set up real-time data tracking. We had never had that for opioids in Arizona, and we do that in public health all the time. We issued a opioid action plan, which had 12 recommendations for things that we thought if we could get, such as naloxone distribution, setting up emergency rules, setting up a opioid assistance and referral line, that we thought that would start making a difference in our opioid epidemic in Arizona.
Arizonans are still dying every day. One report puts it at least 2 a day on average. So how have you measured success thus far?
So a lot of the policies that have gone into place since the declaration, we have seen a 95% decrease in the number of opioid naive people who have been prescribed opioids. That is huge because that is a huge prevention effort. We know that a lot of people who have opioid use disorder never intended to use drugs. They were following a prescription that was given to them for a medical condition by their provider. And we know that if you're on it over 5 days, you have a higher likelihood of still being on that opioid a year later. So we worked with physicians. There's been a pain and addiction curriculum that has been set up and is currently being implemented in 70% of our undergraduate prescribing programs in Arizona. And we also hear that Florida, Minnesota, and a couple of other states are considering adopting Arizona's curriculum. We've also seen an increase in the number of naloxone doses that are being dispensed, but also being picked up by the pharmacy. So that was another policy that was put into place by the legislature, signed by the governor, so that if you have a loved one and you are fearful that they could overdose, you can go get the life-saving drug naloxone so that you have it on hand.
What's beyond the state's control? I mean, there are other people and other agencies that have stepped up or maybe still need to in this process.
Some of the challenges we're seeing now is Arizona is a healthcare workforce shortage area state in many areas, especially our rural areas. But there's not enough substance abuse treatment providers who can treat the population that needs to seek services. The other thing that we have noticed through our data is that we are seeing increases in fentanyl like we hadn't seen before. So now they're accounting for about 25% of the overdoses, when before it was like 20 cases. So we are seeing that with the rise in fentanyl and another rise in the number of people who have overdosed on 2 or more drugs. that counts for about 50% of our overdoses. So really starting to partner with law enforcement and show them the data that we have and what we're seeing, because Arizona hadn't seen that significant fentanyl use until about the end of 2018.
Are patients part of this equation when you look at solving the problem?
Yes, absolutely. So what we're trying to do is reduce the stigma that's associated with seeking treatment and getting help. Opioid use disorder is a chronic medical condition, just like treating your high blood pressure, your diabetes. It's going to be a lifelong treatment, but there is treatment available that is successful, and so really encouraging people to seek help when they need it.
This has been, a multi-million-dollar approach on behalf of the state. How long is it sustainable? I mean, where do you rate the cost moving forward?
So we always like to say in public health, while it will cost money to do that, you're saving people's lives. We have been lucky that we've received lots of federal money through federal grants, so the federal government has been providing a lot of money. The state legislature gave a $10 million, what we call the Go Suds Fund, so it's substance use disorder for people who are uninsured or maybe their insurance doesn't cover it, so that they can seek help as well. And a lot of entities and stakeholders have also put resources forward. We know that it took us many, many years to get where we are today, and it's going to take us years to get out of this.
Some communities are harder hit than others, and the resources aren't always there. And there's a county perspective as well. Is the state mindful of that as it tries this approach throughout the state, where it says, we know there's not enough resources in some communities?
So yes, and we know that every single county in Arizona is very different, their population, their environment. So what we try to do in public health is some of the grants that we've received from the Centers for Disease Control and Prevention, we've tried to pass that money down to our county health departments so that they can implement initiatives that they know will work in their communities. And every one of those has been very different. And so when you look at what Yavapai or Pinal is doing, that's different than what Maricopa is doing, but they're all targeted to their specific community.
I know this act really only came into effect a couple years ago, and it's not as easy as flipping and saying we're solved. But is there a timeline that you'd like to say, hey, by this point, this is what we'd like to see?
We would like to see a reduction probably starting within the next 5 years. It is going to take us a while before we can get there, especially with the introduction of fentanyl into Arizona. So we anticipate that it is still going to take several years.
Okay, Dr. Kara Chris from Arizona Department of Health Services, thank you.
Thank you.
As we just heard, the opioid crisis gave rise to fentanyl, a powerful painkiller developed in the 60s that is now manufactured illicitly. Last year in Arizona, fentanyl factored into more overdoses than any other drug. Federal agencies are working together to keep fentanyl from entering the state. Reporter Judy Alley has more.
So these are the RPM.
Chief U.S. Customs Border Protection Officer Hector Navarro has fought on the front lines of the war on drugs at the Arizona-Mexico ports of entry for 15 years. All illegal substances are the bad guys, he says, but in recent years, enemy number one has become a new narcotic.
We initially thought we were seizing cocaine because the quality or the characteristics of the narcotics, they're very similar. Visually, they look very, very similar, but we run into a problem where we're doing the field testing and it wasn't testing for cocaine.
What it did test positive for was the potent synthetic opioid, fentanyl.
That was a big game changer. The dogs were not trained to detect fentanyl. There was a big push in the first quarter of 2018. That's when we started training our dogs, and it happened at the local level.
Not only did the training of drug detection canines change, but due to the deadly nature of fentanyl, so did the way CBP officers intercept narcotics.
We used to get samples right away where we made the seizure. Now, we extract all the packages and test them in a controlled environment, so there's no additional exposure.
Pure fentanyl is about 50 to 100 times more potent than morphine and heroin. Ingesting only a couple tiny grains can kill a person. Caution is a priority for CBP officers. Gloves are always worn, and Narcan, a medication used to block the effects of opioids, is always on hand just in case.
Most of us used to carry a probe, which was basically a car antenna cut off with some notches in it, and we would probe packages, in a seat or in a dashboard, wherever we found a narcotics package, we would probe it just to get an idea of what it potentially could be, and we have put the brakes on that.
Supervisory CBP officer Hugo Nunez says about 90% of the fentanyl that enters the U.S. comes through the U.S.-Mexico ports of entry in the form of powder and pills. Most of that is caught at the San Ysidro port of entry in San Diego, with the Arizona ports of entry ranking number 2.
Last year in January, down in the Nogales, Arizona port of entry, the CBP seized the largest amount of fentanyl in the United States. There's about 254 pounds of fentanyl.
Drug Enforcement Administration Acting Special Agent in Charge, Apolonio Ruiz Jr. says the chemicals that are used to make fentanyl usually originate in China, are then mailed to transnational criminal organizations or cartels in Mexico, with the ultimate destination being the United States.
The Mexican TCOs are building pill press machines. They're putting them along the border, and also in Sinaloa and other areas, and that's where they're getting the fentanyl powder, and then they're lacing the pills with fentanyl.
While the powder form of fentanyl is still popular with smugglers, officials say they are seeing an increase in the pill form because it's easier to transport.
We have made seizures in stacks of tortillas, inside of pictures, like large painted pictures. Tables have been hollowed out and then filled with narcotics. So if you can imagine it, the attempt to smuggle narcotics using that method has probably been tried.
Detecting fentanyl can be challenging because of the thousands of cars and pedestrians crossing the border each day.
We have to balance between legitimate trade and travel and the interception of narcotics. So our mission is very important. We literally could not inspect 100% of the people traveling into the U.S. It would shut down commerce, and it would shut down travel, as well as the tourist industry.
High-tech tools like radiation portal monitors and drive-through passenger vehicle imaging systems help identify contraband and expedite inspections and searches.
Any anomaly that we see, we can go right to it or bring the dog right to it.
We have to try to hit them where it hurts the most. And if we're doing it right there, at least it prevents it from coming into the interior.
Powerful new chemical detectors, similar to ones currently used to detect explosives on airplanes and narcotics in prisons, are also being tested for use at the borders.
Any new tool that is effective and we can get our hands on, it just makes our job easier and safer. And it's not only for our safety, but the safety of every American.
But Officer Navarro admits machines are not foolproof and dogs can make mistakes. The best tools in the fight against fentanyl, he says, educating the public on the dangers of this ominous opioid and the gut instincts of the men and women who battle on the border every day to keep them from coming into the communities.
Well, the human factor is number one. The officer experience as he learns his job and gets better and better and better, you can never replace the officer.
Well north of the border is the Pinal County line, the third largest county in the state of Arizona. Though not directly on the border, it's one of the few counties in the country that receives federal funding to combat drug and human smuggling. Sheriff Mark Lamb says, like other law enforcement agencies, he and his deputies have had to adopt different strategies to combat trafficking through his county.
You know, we are about 60, 70 miles north of the border, but just like everywhere in America, everybody's being impacted by the opioid crisis. We're no different. We had a few weeks ago, we had a full week where every morning I woke up to an email where somebody had overdosed. So we're not immune from it.
The drug problem, Sheriff Lamb says, has broken records. In 2019, a 75% increase in fentanyl seizures alone. The drug coming in multiple forms, 9 pounds of powder, nearly 700 pills. The busts are the results of narcotic investigations, but some of the most notable have been traffic stops.
Especially on the I-10 freeway and the I-8, That is one of the main corridors for the cartel bringing drugs into this state and into this country. And so we feel a great responsibility to try to protect not only Arizona and our county, but the entire country from these drugs coming in. So we're seeing those opioids coming in. We're seeing the heroin, the meth. We get it on the border, on the south end of our county. We get it in our communities. So yeah, we're seeing it every day. The deputies see it every day. We've actually had, I think, 4 deputies in the last 6 or 8 months that have actually gotten some exposure to it while they've been dealing with an arrest person or a DUI, and they've had to give themselves Narcan or somebody else administered Narcan to them.
How prepared are your deputies to handle that?
I'd like to think we're prepared. We try to prepare for all situations. Everybody carries Narcan. I carry Narcan with me. And a lot of times we use that Narcan to help other people that are overdosing. But it's also there for us to be able to save ourselves if we get an exposure.
One of the largest and most recent examples happened in March.
We did a traffic stop. It was a cold traffic stop, which means that one of our deputies just stopped this car, and the driver, and then there was a passenger, and she was dressed as a nun with a Bible on her lap. When we started digging into it, because something didn't seem right to the deputy, their answers weren't consistent, it was making his interdiction alarms go off. We ended up finding 8 pounds of granular fentanyl stuffed underneath her dress that she was trying to smuggle into this country. 3 grains of granular fentanyl, like 3 grains of salt, if that's how much you had. 3 grains of salt, that amount would kill you and I. 1 grain of carfentanil, which is even more dangerous, would kill somebody. This lady had 8 pounds of it. That would kill thousands of people if that were to be released into the public. So very dangerous drug.
So who do you blame? How can the cartel penetrate this region and get into your county? I mean, how is this possible?
I've never found blame to be that productive. However, we all share some blame. The cartel shares blame because they provide the product. But we as Americans need to accept some blame because we've tolerated this drug abuse to enter into our communities and into our families, into this country. And it's a powerful, gripping thing. Sometimes, you don't have control over it when it gets a hold of you. And we've got politicians that have failed us. I think a lot of the responsibility for what's happened here should fall on their shoulders because they've failed to give us the proper tools to protect our borders, to protect our communities. So I don't want to really cast blame. We're all to share some responsibility in this epidemic that we're experiencing in this country.
How do you fix this sort of problem?
That is a great question. I think a lot of people answer that, and I'm not sure that I've got the answers to that. I always say, I joke that it's above my pay grade. I have to focus on what I can do as the sheriff and what we can do as the Pinal County Sheriff's Office. I can't control what other agencies do. I can't control what the feds do. I can tell you we have a great working relationship with all of our local law enforcement, with our federal partners, and without that, we wouldn't be able to get done half of what we do. But we still have a huge fight that we're fighting here with the drugs and the cartels. You have to look at it like this. If you take a large business, let's say Walmart. Walmart has an acceptable loss that they will tolerate, whether it's stolen goods, damaged goods, and let's say that loss percentage is 15%. Well, the cartel is $1 billion business, and they also have an acceptable loss ratio. We have heard that it's between 20 and 25%. So the fact that over 20 years they've changed their tactics very little says that we're probably not even impacting them to that 20 to 25% margin. And that's what's scary, is to think about, I've got Connex boxes full of marijuana, and I've got a whole top shelf of the evidence room that's full of drugs, and to think that that's maybe only 20 to 25% of what's coming into our communities, that's alarming.
In revisiting the opioid epidemic, we were reminded of the enduring pain caused by addiction from Jerry and Louise Bytel, a couple we first sat down with in December of 2018, mere months after they lost their daughter, Kelsey. Kelsey Bytel didn't die from an overdose. The coroner's report found she drowned. Discovered in a pool on Tucson's east side, as we reported then, her parents described a year-long addiction to meth and opioids that put their only daughter on this fatal path. Now, more than a year later, we've asked the Bytels what they have realized since about the challenges families face when trying to help a loved one overcome an addiction.
I think we didn't realize at the time the pain of addiction and the embarrassment that she had because she couldn't control it.
She didn't want to let us down.
Treatment is expensive. In hindsight, what do you wish you would have known?
The cost for us immediately, and that was
astronomical.
When I called to try to get her into treatment, it was $2,000 a day, they told me. But then they asked me, is she access eligible? Or does she have an access card? And I says, well, she doesn't, but she certainly would be eligible.
She had
she
just
had nothing.
returned to Arizona, so she didn't have time. But we fast-tracked it, probably broke a land speed record on ever getting her an access ID card in less than 24 hours, which I heard that's absolutely impossible, but I was able to pull it off.
So they scholarshiped her on the 21 day. And what I'm thinking is that money was done, and that's why they released her out. But I wish we had more information as far as what the next steps would have been, because I think she wasn't finished. She needed, and she told me she didn't feel like she was really ready to be out there.
And I picked her up on Wednesday before Thanksgiving. They released her a day early. And I remember her at noon. I was supposed to be there to pick her up. I remember with all her belongings in a plastic bag over her shoulder, she was skipping. And I opened the double doors, she literally jumped in my arms. And I said, wow, she's all better. It's like getting over a cold.
But to us, she seemed like she was okay.
How little did we know that was just the beginning.
That easy to go right back to it again.
Relapse, easy.
Kelsey was 27, very much an adult, so your hands were tied when it came to helping her. What do you tell families like yours who are trying to help an adult who's struggling with addiction?
Well, that's the problem, and I think that's where I think an involuntary commitment type law should work. I had her in a doctor's office. They spent there was five people trying to convince her that she needed to go to detox, and she just wouldn't go. And that would have been the time to put her in involuntary drug treatment program.
What she said, why she didn't
She
want to go?
told me she told us all that she had to make peace with the drug.
What does that mean?
Since Kelsey's death, you've met families like yours who are looking for some sort of answer. What do you tell them about having hope for the future?
I think those are the questions that I'm still asking. If I got my hair done last weekend, and I found out that there's another lady going through the same thing we went through, and he's in his 40s, and he destroyed her house because of the paranoia and going through all of that. But I asked myself, what would I tell her? What is she to do? Honestly, I don't know.
I don't either.
Because he won't voluntarily go.
And you can't force them if they're an adult.
Let's say we have the same conversation in another year or so. What do you expect will be different then?
I think the support systems for the families going through this situation, I think there should be some kind of playbook.
We had to sit and watch our daughter die over a period of time.
I know last time we spoke, you said that Kelsey wanted to change the world, and that has sort of become her motto. She's not here anymore, so how can she change the world?
Through us. It's through us. We're taking the what's the word we just torch. We're taking the torch, and in her honor, that hopefully we can help other people from succumbing to this.
They also see hope for others in the Arizona Opioid Epidemic Act's Good Samaritan law that took effect in April of 2018, which can allow people to report an overdose without facing prosecution themselves for drug use. They suspect if Kelsey had actually overdosed before ending up in a swimming pool, greater knowledge of this law could have potentially saved her.
Maybe that law that nobody knows about might have helped her, because somebody would maybe freaking out, oh my God, call 911. They may have come up to the condo unit rather than be pulling her out of the pool, trying to restart her heart. Well, by the time they restarted her heart, the brain was deprived of oxygen too long and she had no brain activity.
It was the water that killed her, not the drug. She had a lot of drug in her system, but.
You've lived in agony for the last year, but you sound hopeful and optimistic. Is that what I'm hearing?
Yes, absolutely. We want to help people, so parents or caregivers, that they don't have to go through this nightmare.
I don't know how much people really understand. You can look at the laws and everything, but what families actually go through. And again, knowing what to do. That's the question. I mean, if somebody asked me today, what do I do? This woman whose son was going through this right now, exactly what we went through, what do you do? I don't know what to tell her.
Because when we went into this with her, we were completely stupid about drugs. We had no idea about it. We were crazy. I wish I had done the research before, so I knew exactly what she was going through, and I would have probably been a lot more sympathetic about what she was going through and the pain and everything. And then she joined, and I'll let you explain about a prayer registry that she had joined that was really helpful for us and inspired us, and that kind of helped us get through
Well,
it
and
too.
in that registry, I mean, a lot of people, they talk about how it's everyone who's lost children, and a lot of them are drug overdoses. Really? So, I mean, it's...
And she would send me the links, because it's daily emails, and they'd come in. And I said, Louise, do you notice the similarity in these stories? I said, all you do is erase the person's name at the beginning and place a new name in there, and the story is exactly the same from the previous day or week or whatever. It's insane.
You're not an expert, yet you've experienced the worst, and you still don't have the best answer to give a friend who needs the same help you did.
Because it's not out there yet.
Beyond unknowns about addiction, this couple is still anxious for answers about the circumstances that led to their daughter's death.
I just want to know if there's anybody that's out there that really knows what happened and wants to come clean, to call the law enforcement or call 88 Crime or something, because I think there's somebody out there that really, really knows truly what happened to her that night.
Before we go, a reminder that our coverage this week is part of Arizona Addicted. Over the course of 12 weeks, Arizona Public Media will explore the solutions, stories, and science behind the ongoing opioid crisis in southern Arizona. Here on Arizona 360 and across all of our platforms, look for our coverage on PBS 6, NPR 89.1, and AZPM.org. And if you have a suggestion or feedback, send an email to Arizona360@azpm.org. That's all for now. Thanks for joining us. We'll see you next week.